Presentation by handing it off to Jeff Hughes.
Hello, everybody. So thank you. I appreciate the opportunity to visit with everyone. Today, we're going to discuss opportunities that may be there within your state through Medicaid managed care. The reason that we decided that we were going to do this today came about from a discussion that Mary and I had several months ago with a few other people around Medicaid managed care and the opportunities that are there for providing the necessary services to people with disabilities, especially around this time of COVID. So we thought that we would give kind of an overview of one entity that has prepared quite a bit of information about what they would like to see and what they suggest for Centers for Independent Living in working with specific MCOs, managed care organizations. And this came from the stuff that I'm going to go over is kind of specific to Anthem, but it can be applied across the board to any MCO. It's good strategies to look for and how you can become a little bit better organized as or if managed care is moving forward within your state. So if I think that there in some fashion that there's around 39 states to where managed care organizations are operating at this point, maybe a little bit higher than that now, but I think the last time I looked it was around 39 or so. And as we go through this, this is intended to be an interactive discussion around what is going on within your state that that you might want to discuss, opportunities that you have capitalized on, things that you've missed out on, and if there's a way that we can help provide additional information or technical assistance around this whole big huge beast of Medicaid managed care, then we're very happy to do so. So I'm the center director in Norman, Oklahoma, Progressive Independence. I've been around for, this is my 21st year at PI, and we serve the Oklahoma City metropolitan area, but also we are planning on picking up areas within the very southern part of Oklahoma and the southwestern portion of Oklahoma because of our partnerships with a couple of the Medicaid managed care organizations. So real excited about the opportunities that this has brought, because now with this we're able to reach out into those areas that have been unserved and underserved within Oklahoma for such a long time. So let's go ahead and jump in and get started. Let me see if I can figure out how to share my screen here. All right, so you may hear a little background noise, and I apologize for that. I'm having a little music studio built in our backyard as we speak. I didn't know it was going to be today, but they are working on that. So a couple of the things that with Anthem that we've developed and worked on is 6 principles necessary to modernize a healthcare infrastructure. And they are enhancing self-care through improved coordination, encouraging community integration and involvement, expanding accessibility of services and supports, upholding personal preference, empower people to participate in the economic mainstream, and invest in improved technology. Here in Oklahoma, we've had some pretty substantial challenges through our Medicaid system, including our 1915C waivers, as well as the straight sooner care, which is our state plan services. Over the years, we were one of the first ones back in the 90s to first try Medicaid managed care, and the companies that came in at that time didn't do so well. And so, we've had to work through some of those struggles as well, because there are some people that are still around that remember the struggles that we had. It didn't really go well because, various issues, but over time, some of the Medicaid managed care companies have really learned from specific people like Bob Kafka, like Mike Oxford, Kelly Buckland, and many, many others on how to improve services as a state moves towards this direction. So as you can see here, this is Anthem, who I'm on the board of the National Advisory Board within Anthem, and I'm real excited about these principles that they have put forth. So enhance, as a MCO is working within your state to address the needs and the gaps and the barriers that people with disabilities have, you'll want to make sure that these 6 principles are being adhered to, that there is within the plan, as you're coordinating with an MCO, that you're meeting with them all the time, as much as you possibly can. We want to put forth as a center network, you want to put forth a really good organized approach to working with the MCOs so that they can provide services statewide, that you're ensuring that people with disabilities are at the table, that within their plans that they are addressing how self-care through their coordinated services are being addressed. And here, we've had so many problems with our state agencies that, we were one of the first ones to receive one of the Real Choice Systems Change grants back in 2002, 2003. We were working with the state to offer consumer directed services. And the intent was that the centers were going to pick up that piece of being the fiscal intermediary. And unfortunately, the state and home health agencies got together and pretty much just took it away. And now the fiscal intermediary comes from one entity, one national entity that you probably have heard about. They've gone through several of them over the last several years because they're just not really good support and services that are being provided day to day. And that's something that should be provided by the centers, whether you're going to do the fiscal intermediary part or if you're going to do the just the employment support alone. Then you guys, we Centers for Independent Living, you've got to be engaged with whatever MCO is going to be working within your state. So right now we've got agreements, Progressive Independence has agreements with 4 of the 4 MCOs who've applied. We're going through another round of applications probably this fall, and I pretty much anticipate that it's going to be probably the same 4. There might be one more jump in. I hope that there will be. And so we're engaging each one of them to make sure that we've got all of these issues addressed and that we can create different services and programs that is at our core values, our core services of transitioning, helping people move from institutional settings in the community or from high school on. That's one of the core components, obviously, that we must provide services around. And these MCOs have been great to work with at this point in time. One of the services that we've developed because of all this is personal care training and registry for people with disabilities. This has not ever been done that I'm aware of in Oklahoma. And so with this, we'll be able to offer training on how to direct your own services. And we are putting people with disabilities alongside individuals who may be interested in providing that personal care side by side through training that's about 8 weeks long. And that part has gone really, really well. Well, question is, will you go back and please explain what Anthem is and what agency Mr. Hughes is speaking from? So Anthem is a Medicaid managed care organization, and they are in various, I'm not exactly sure how many states at this point. They're in several states providing services to people with disabilities and people who are aging through Medicaid services. And I work for a Center for Independent Living here in Oklahoma called Progressive Independence. We'll scroll on down to the next slide, which is encouraging community integration and involvement. So obviously, as a Center for Independent Living, we are concerned about the degree to which people with disabilities are involved in issues such as transportation and housing, recreational and opportunities as well. One of the biggest barriers that we have is as people with disabilities move into the community or are already in community and looking for a place to live is housing. We know that safe, affordable, accessible housing there's such a shortage with regard to that. So how does that really fit into this whole framework of healthcare and Medicaid managed care? So is this something that is compensable through Medicaid? And those were some of the questions that we had when we first started working with some of the MCOs. And the beauty around doing so is that they can, through the money that they already have, they can create strategies to increase accessible housing. They can work with centers to go in and do accessibility surveys of what already exists, to have a good inventory of accessible units. One of the projects that we're working on right now is to have an inventory of statewide of the number of accessible units that are there. And that's quite a undertaking, but with the support that you can get through a Medicaid managed care organization, then you can have the resources available to you if you work with them in identifying the number of accessible units. Social obviously is the impact of having social opportunities through Medicaid managed care is incredibly important, and something that the state hasn't really felt like it's been all that important. But these organizations do realize that, as part of living day to day, you have to have that opportunity to socialize. So resources can be set aside to do various support services through social and recreational opportunities as well. Expanding the degree of accessibility of services and supports is always something that we're always concerned about. Again, as I mentioned, here in Oklahoma, we have struggled over the last many years, 10 years, probably started around 2010, 2011, where Medicaid services were took a downturn. And it was really difficult, one, to find doctors within specific geographical areas. I'm located here in central Oklahoma, and it's really, really hard for us to find good physicians and specialty services that accept Medicaid. So and plus with them being, finding ones that are accessible is incredibly challenging too. So one company in particular, Centene, donated several thousands of dollars to National Council on Independent Living to address this issue within healthcare providers and accessibility therein. And we're very thankful for companies like Centene and Anthem and some of the others that do recognize the importance of independent living. And Amanda Montgomery asked, what about surveys on housing units that could be made accessible? Yes, that's part of the inventory that we're trying to come up with. And, if there are, let's say, if there's a housing complex of 6 units, it is covered under fair housing. And so there's got to be a minimum number of accessible units that will be made. And so there could be opportunities to renovate, to make accessible some of those units. And, again, it's a matter of engaging with whatever MCO is there within your state. And last I looked, I think that there's a minimum of 3, maybe 4 MCOs that are required to be within a specific state, and that is set forth by Centers for Medicaid and Medicare. Upholding personal preference. So an individual with a disability, this is one that I feel really strongly about here in Oklahoma. Personal preference, choice of providers, having an opportunity to really have a choice is something that has not been offered within this state. What the state will tell a person is that, well, you can choose a different provider or a case management provider or whatever, but you're still offered the same sets of services, the same thing over and over. So there's nothing that offers anything any better. This is it. This is all you get. It's administered by the state. There's nothing more. As we're moving into this approach, now we will be able to offer an array of services that a person could truly choose from. So, in other words, we have this last round of applications that we had. There were 4 organizations, 4 MCOs that applied, and there was Blue Cross Blue Shield, Humana, or that were awarded. There were Blue Cross Blue Shield, Humana, Centene, and United. Each one of those will have an array of services that they're going to provide, that are going to offer, that they will offer to individuals with disabilities and also people who are aging. That could include consumer directed services. It could include home mods. It could include equipment. They're going to have to provide the mandatory services, but there may be some optional services that they'll also want to include. I know that Humana gives $150 each month through its Medicare program to individuals who are enrolled with theirs to cover any ancillary services that they may not be covered. And there's going to be different ones that are going to be offering transportation services on a much higher degree, or personal care, or whatever it is. There's going to be a true choice that hasn't been available prior to this. There is a question on how can we find out if there is managed care in our state. You can ask your state and how your state Medicaid agency, how are services being delivered, who's doing it, is it administered by the state, is it a third party like Medicaid managed care. That would be the first thing. And you can also go to CMS's website and look up Medicaid managed care. You just Google that and your state, and it'll come up with a list of organizations that are providing services there. Employment. This is one where here in Oklahoma, unfortunately, we don't have a Medicaid buy-in. We passed legislation back in 2001 to require our Medicaid agency to do it, but no one has held them accountable. The legislature, in particular, there was one side that didn't want Medicaid to expand any further than what it has, and that's really been the challenge that we've had with trying to get a Medicaid buy-in up and running. And obviously, in having that, that's going to allow people with disabilities to go to work without being penalized. People can go to work under our existing framework, and 1619B, Medicaid 1619B will be available. So a person could earn potentially up to around $30,000 a year, but that's it. And so obviously this is something that we have to get moving so that people aren't limited with their income. We do have agreements with a couple of the Medicaid managed care organizations that we will be able to offer that component. So again, if we go back to personal preference and choice, then this will be a opportunity for people to participate in this. I'm hoping that this session will that's going to pass without, and it'll be available statewide to everybody. There is a big fight going on within our legislature over this, and but I think it's going to be resolved, and I think we'll be okay in moving forward with the Medicaid managed care approach. Technology. One of the debates that the Senate had last year, the Oklahoma State Senate, there was our President Pro Tem making comments about trying to control the costs around durable medical equipment and wheelchairs and that sort of thing. So there is some concern from our community about what does that mean? How are they going to control this? What does that mean for people with disabilities who are already having a really difficult time in accessing the equipment that we need, and supplies and any type of assistive technology? That's not something that many case managers, our existing case managers, are really educated on. There's very little training, and under one of our waivers, and people with disabilities aren't even part of that training. They don't coordinate with the centers to offer any training around disability issues or anything. So again, this is another one of those reasons why, we're very supportive of moving to a managed care, Medicaid managed care approach. Because I know that companies like Anthem or Centene or United or a couple of the others are going to reach out to the centers and say, well, let's talk about what type of technologies are available so that this person can live more independently, and not have to wait on a personal care attendant to come in and help them get dressed or help them get into the bathroom or something like that. We are going to look at different types of approaches. And this is, one of the things that, the state's really been needing to do for many, many years, but unfortunately, they don't see it that way. So there are some big changes that are going to be made around the access to assistive technology. One of the approaches that we were trying to address last year prior to the RFP closing was how can we reach out to different minority groups, people of color, and so I used a lot of the relationships that I had growing up, and I grew up in close to a town by a historically Black college, Langston University, that I'm very proud of, and I took classes there, grew up within that framework. And so we started there. And how can we improve healthcare, to address the healthcare disparities within unserved, underserved groups? And I was really excited about the approaches that we were going to take and are going to take, specifically around people of color and involving people with disabilities around policy making, developing policies and procedures. You'll have an opportunity to get involved with an advisory committee or a board, as things move forward. And again, if you're not familiar too much with Medicaid managed care and want additional information, reach out to Mary or myself. Happy to provide any additional information that that you might need as an MCO might be working within your state. You can also use, if you get involved with an MCO, and you can use that opportunity to, as I mentioned on the previous slide, to reach out to various groups that haven't been provided services at this point, unserved, underserved populations, which could include people with autism, brain injuries or head injuries, developmental disabilities, mental illness, and you can reduce healthcare costs by making sure that wellness and prevention services are being provided. That is here in Oklahoma, that's not been something that's been utilized very much at all. We do not have a very good, robust system to provide services to people with head injuries. I'm pretty embarrassed about that. We had worked with the state, our state Medicaid agency, back in 2006, 2007 to to apply for the Money Follows the Person grant. And within that grant, we had written in there, all 5 centers in our state was heavily involved in that application. And within that application, we said that we wanted nursing home beds to be closed after a person moves out. And then that full amount of money would follow that person into the community so that we would have additional resources to provide to that person and or serve areas that we've not been real efficient in serving, such as people with head injuries. And it is, I hate that we've not been able to do that as of yet, but that is something that we will get addressed as we move forward with Medicaid managed care. People with autism, very same thing. People with spinal cord injuries. It's not, we don't have a good, robust system at all. And frankly, with, my personal opinion is I don't feel like any of the systems that we currently have are very good at all. There will be people that'll disagree with that, but that's just my personal opinion. And finally, you'll have an opportunity to increase funding and being flexible to serve communities as that people need, that people will be needing. You will be able to improve education services. You'll provide incentives through this whole Medicaid managed care. So there are a lot of opportunities and a lot of support that you can get, but the key piece of this is to be sure that you are engaging your MCO as they come into your state. And how do you do that? Well, it's, I spent a whole lot of time just getting on the phone and tracking people down. And I am pretty persistent with any of them. I'm not going to just sit by and let an organization say that they're going to come in and provide services without at least meeting with us, meeting with our consumers. We set up, when the first time that we started meeting with MCOs, we set up a series of meetings so that Aetna would come in and meet with people, meet with our consumers to answer their questions and concerns. Centene did that. Molina did that. Humana. Blue Cross Blue Shield has not done that yet, but we'll make sure that they do on this next round. United, same thing. We always want these MCOs to answer the questions of our consumers as to how this is going to work and how their needs are going to be met. It's not about my agency per se. It's, specifically about addressing the needs of our community. And our community has done, we provided a lot of training and a lot of support, a lot of educational opportunities for people to learn more about Medicaid managed care and how the systems could be structured so that increased services and supports could be available. So when we go into these meetings, they're very well versed and they understand exactly how things are going to work. And so when, an MCO comes in wanting, saying whatever they're saying, blah, 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 people are drilling them with questions about, well, how is this going to work? And how am I going to receive supplies like catheters or blue pads, or how is wound care going to work? And they really push on them and hold them accountable. And so the ones that we work with and that we want to have part of our infrastructure within the state, they're the ones that our consumers will say that these are the ones that we want to work with. And if they don't want to work with them, then we don't go. We don't do it. And then we're very open about, who should and shouldn't be part of this framework. And that has worked really, really well. So I encourage you, if you haven't done that, to make sure that you're involving your community with what this could look like, the opportunities that could be there, and help people become more educated around this issue. And then that'll make your job a lot easier as you're providing services, as you're coordinating services, as you're providing information to people about this whole Medicaid managed care framework. And we have a question. She would like to know if you guys have independent living, assisted living facilities for a lot of youth like myself that already have Medicaid in our area of Atlanta. And just to let you know, I already have Medicaid insurance and personal Social Security income letter for me, as well as one of my Social Security. Yeah, one of the things that I know that Centene is really supportive, and Centene and Anthem really want to address is around the whole issue of providing services to youth, younger people. And Centene would be one of the first ones to tell you that, you know, April's done such a really good job in reaching out to younger people with disabilities. And I know that Centene will want to continue supporting any efforts that are around youth-driven support. So there are a couple NCOs that do want to see increased supports around those issues. So if they're not in your state, then, you know, find out who is, and let's talk about ways that you can get some of these other MCOs in. There are some horror stories. You know, I'm not going to sit here and pretend that it's all, you know, just roses when you have Medicaid managed care organization come into your state. There are all kinds of horror stories that we all hear in different states. But I will tell you that in Oklahoma, that we have not had Medicaid managed care and for many, many, many years. And when we did, it was just a half-ass approach from the beginning. So if this does go ahead and move forward, which it will, you know, it is going to be drastically different in providing the supports necessary for people here. The state of Oklahoma has done an awful job in providing the services to our community. I've been very vocal about it with our healthcare authority, with our legislature, and with the Department of Human Services. And it amazes me that they still receive funding to the degree that they do, and yet not really providing much services at all. To give you a good example of what has gone on here. So in 2016, in the Oklahoma Healthcare Authority's annual report, which covers all Medicaid services, including waivers, there was only 168 home modifications done in statewide. So only 168 of all the people that are on Medicaid. And we run into people dying literally to get that service addressed every single day. So we do have substantial problems within our state, and are very excited to have an opportunity to improve the services and supports around our community. So with that, you know, we'll open it up to additional questions. You know, that covers the 6 principles that we want to see as Anthem addressed through any type of a Medicaid managed care approach. These should be described within any application that is put forth. You know, the state will put forth an RFP, and then, you know, have a bidding process, and then they describe what services are going to be provided. One question is, can you give me a concrete example of how an MCO would help my CIL? And I absolutely can. So as I mentioned earlier, one of the things that we are doing is personal care training and registry. So we've developed this training that is based upon a consumer-directed approach. And we cover everything within that training, from how to hire, how to advertise, how to provide additional training to your personal care attendant, to also providing training to a potential personal care attendant. And that program is going to be funded through one or more Medicaid managed care programs. So that's one specific example. Another specific example is that we are, I just took over an additional space, office space, where we will be providing healthy cooking classes on a fully accessible kitchen that will be have the fully accessible stove, all the accessible features that you would want within your kitchen, so that we can demonstrate that, but also on cooking healthy and eating healthier by using things like HelloFresh and something as simple as that. There may be $1 more than what a person may receive through quote Meals on Wheels, but is so much fresher, so much better, and so much better for you. That will be another approach that'll be funded through an MCO. So housing opportunities, and going out and surveying your housing inventory, accessible housing, and providing the resources to make a place accessible. That's another project that could be utilized. So it's all there, but create creatively on how you can provide services through your center. What about nursing home transition? We also have an Open Doors Fund where we will assist people with disabilities who are moving from an institution to the community for covering first month's rent, utilities, and a little bit of clothing, if they need food, allowances, stuff like that. That is funded through Medicaid managed care. During this time of COVID, it is so vitally important that we are engaging with our community around, vaccines. So we, earlier this year and all of last year, we were giving out iPads so that people with disabilities would have that social interaction, would be able to keep up with vaccine related information in rural areas. I don't remember the number that we ended up giving away, but it was a bunch of iPads so that people could have contact day to day with whoever that they needed. And also so that we can provide vital information around what people needed to be doing to get on the list, the quote list for your vaccination. And MCOs were funding that initiative as well. And as I mentioned with the COVID vaccinations, this is something that I feel very strongly about, that centers need to be involved in developing the strategies around assisting people with disabilities, providing that opportunity, and maybe even getting people to and from a site to be vaccinated, or maybe you want to host it yourself. You can also engage centers for independent, or you can then also engage MCOs around that initiative as well. I know that Anthem has been very, very, very active around trying to get out good information around the vaccinations, and I'm excited to be a part of that. That's been a really good benefit in being involved in this. So I first got involved with Aetna in its advisory committee, and You know, Aetna's gone through some struggles, and some people have left. So, you know, I'm no longer on that committee, but then I moved over to Anthem, which I'm very excited about being part of. It's a great group, great information being shared. It is a leader among healthcare. So if you have that opportunity to get involved with one of them, I highly encourage you to do so, because you will learn a great deal of information. Question is, how do I find out if I have an MCO in my state? How do I send them ideas on first steps, getting to pay for things like HelloFresh program? So as I mentioned earlier, reach out to your state Medicaid agency, or and find out if you're already, if Medicaid managed care is already an option within your state. But you, as I mentioned, you can also go to CMS's website, and Mary can probably get you the link to that. And it'll tell you as well what MCOs are operating within your state. And put forth a proposal. Think about just like a grant or something. Come up with an idea on what you're wanting to address and why. And then go meet with the CEO. Each state will have a CEO over that plan. And so, you know, the United has a CEO here in Oklahoma, and Humana has a CEO. Centene has a CEO. Each one of them will be over that plan, and go meet with them, take them to dinner. Just like you would any other funding source, that this is what we want to do. And how can we get support from hello, Mr. MCO or Mrs. MCO, on getting some funding to our community and utilizing the centers. And, you know, it's the more of you that do it, the better engaged that you will be long-term. And so right now, I think that my agency is about the only one that's really been supportive of this Medicaid managed care concept. And I think probably because you know, the other centers just don't see exactly how it's going to benefit them and their consumers. And so we've got a little bit of work to do to bring some more centers on board. And, you know, so we're going to be doing a little bit more work with that. Hey, Maureen. And Maureen Ryan from Wisconsin suggests that any state that has a Medicaid managed care also requires an independent ombudsman program to address issues that come up. And that's very much true. There are going to be issues that come up, and you will want to have a third party entity that will be working with you. You don't want, unfortunately, what we've had over the years is one entity doing it all, and that's been the Department of Human Services. And so, you know, they've really buried our community-based programs, and because they've, you know, always, you know, if there's an issue, they don't want it to get out, and it's never even addressed. So very much, you know, make sure that you do have an independent third-party ombudsman. That's absolutely correct. Where can we find out more about information about Medicaid buy-in? CMS, or you can go to, you can just Google it, frankly, just do a Medicaid buy-in. Just Google that, and it'll bring up. The Administration on Community Living has put forth a little bit of information on Medicaid buy-in, and I think some's available on CMS's website as well. So absolutely do that. And then if you have additional questions after you do that, reach out to Mary or myself or Maureen. I'm glad Maureen was on this call, and great resources that are available to anyone who's interested in going down this road. You know, Maureen is from Wisconsin, and one of the people that I learned a great deal about Medicaid managed care from was Lee Schultz, who was at Independence First in Milwaukee. He and Phil Pangrazio from Phoenix they're a couple of my best friends, but I also learned a great deal from both of them about how to utilize the MCOs and how to put together a good framework for services and supports. And the idea of putting together a personal care training and registry program came from Phil. Phil's retired now, if you know Phil, but he put together a huge program there in Phoenix that was supported by Medicaid managed care companies. Okay, do we have other questions? I'm not seeing. There we go.
It looks like there's one more comment here. This is a comment. Super interesting presentation, Jeff. People can also look and see if your state offers United Healthcare. They will pay for gym memberships. They have transportation services. They will also send you a card in the mail that will help buy healthy food and more. For example, years ago, my insurance would not cover weight loss surgery, and I got United Healthcare and they paid for it. I live in North Carolina.
Yeah, and again, each MCO is going to offer different stuff. So, make sure that, United does one thing, Centene's going to do something else, Anthem's going to do something else, and Humana is going to do something else. Those core services are all going to be provided, but there is going to be some ancillary services that are also going to be provided. So reach out. This is an opportunity for a center to receive funding on things that they may not have received funding before. One of the things that I get so frustrated with our state is that, they want us to do everything for nothing, which we didn't have a choice. And so we were piecemealing everything that we could possibly think of to, just provide a level of support. And now, as we move in this direction, there's actually going to be resources available to help us do it. So that's real exciting. Something that hasn't really ever been there before. So absolutely reach out to your MCOs, get together with your other centers, or just do it yourself. This is an opportunity for, like I mentioned, to receive some support for the things that, we've all been trying to address for many, many years, but have not had the resources to do so. And also, the beauty about this is that these are private organizations, and you don't have to go to the legislature and pass legislation just to get something done anymore. If it's a good idea and they want to get behind you, then they're going to do it. And that's a hell of a lot easier than trying to force the state into moving forward an inch, and then just to be cut out of something in a backroom meeting. We also, here in Oklahoma, we had an Olmstead Plan back in 2006, where all of our state agencies got together. We all adopted, state agencies, people with disabilities, centers for independent living, SILCs, DD councils, everybody got together ad nauseum to come up with a plan, an Olmstead Plan. And it was pretty good. I mean, it wasn't great. It wasn't the best, but we got quite a bit of stuff in there. And of course, that just went on the shelf like so many other places and died. But one of the things that some of the MCOs have been asking about is, do you have an Olmstead Plan? What about your MFP? Unfortunately, our MFP program is pretty bad. It's operated by the state, and they don't really serve very many people at all. So all of that can change, and this is your opportunity to do so.
Hi, Jeff. We do have one hand raised from Kyla, and we might have time for a short question. Kyla, you should be able to unmute.
That was my fault. My cat jumped on the keyboard.
Oh, okay, never mind. Thank you. I did want to say there were a couple of things going on in the chat. Let's see if I can follow it here. Jacqueline says, if you can dream it, a program or consumer service, then partnering with an MCO for funding and training support may be a way to achieve it. And Amanda says their MCOs are going to provide different services if you have dual coverage, meaning Medicaid and Medicare. And then Kurt says, would that be provided under United only if you are Medicaid? What if you supplement under United and Medicare? Oh, so I think that was maybe an answer. Sorry. That you're going to get different services depending on if you have dual coverage, meaning Medicaid and Medicare.
Yeah, Oklahoma does dual, and it is, you will get different things. Medicare is going to be paid for first usually. And if it's denied through Medicare, then it'll follow Medicaid. A little bit of paperwork there, but there are going to be quite a bit of services that are like here in the state in Oklahoma. Medicare services are being provided through Humana and United, and some of them that do provide Medicare, but I don't think, like Centene, I don't think they provide Medicare services. They're strictly Medicaid. So
Kurt's question does say, but you have to be Medicaid, correct? But it sounds like it depends on who your managed care organization is. Is that right, Jeff?
It absolutely does. So again, you got to become educated on what your state is doing, where it's going with stuff, and who is at the table, because it's never more important to be at the table than it is now. Obviously, we've seen over the last several years how our community has just been kicked aside, and in a lot of ways, I still feel like it's being buried. There are so many things that are going on right now that really affect our community more than ever. And now is the time to get involved with your state. Find out what's going on related to Medicaid. Get with your PNA. Get with your PNA usually can give you a little bit of information anyway. Form those relationships with your other centers, and put together a good platform of a position paper on what you're wanting to see from a Medicaid managed care system. Like Maureen mentioned, you got to have that independent third-party ombudsman. You got to have a advisory committee that's made up primarily of people with disabilities. Home and community-based services have got to be provided. Housing first, you may want to use that type of a strategy in combination with money follows the person.
All right. And Jeff, we're at the top of the hour, so that's a nice little way to kind of summarize everything we need to do. So thank you to everybody for your questions today. And thanks to Jeff for the presentation. And as always, make sure you fill out your review or your survey of this. And I'm sure, like Jeff said, that if you need to get a hold of him, he'd be glad to answer any questions you might have individually as well. So thank you all so much.